we have invited a special guest today to share with you lots of information, how each stage of our lives we can attain great health, maintain good health, and live a life of wellness. Our special guest is our very own North Carolina physician. He is one of the finest physicians in North Carolina. He is well loved by his staff, his patients, and I know you're going to love him too. He specializes in obstetrics and gynecology. And without further ado, I introduce to you and welcome Dr. Vijay Seshadri. Dr. Seshadri, so glad that you joined us.
Thanks for having me.
Yes, thank you for carving some time out of your busy schedule to be with us. I know you're delivering babies, you're taking care of a lot of our girls and women of today, and so we really appreciate your time.
Not at all, no problem. It's my pleasure.
Thank you. So we want to get a chance to know you a little bit and to know what was your motivation and inspiration in becoming a physician and specifically specializing in obstetrics and gynecology.
Sure. So I think that anytime we decide that we want to do something for a living, there's a couple things we're trying to figure out. We're trying to decide, how can we make a difference in this world?
Sure.
You know, where do we fit in the kind of the grand scheme of things, and what do we enjoy doing? You know, what do we love, and what are we going to be good at?
Right.
And for me, you know, as I got through school, it became obvious that my way to make an impact on the world was to be a physician and to help people out. And so this is my small contribution to society. As far as women's health care goes, it's interesting because when you're in residency, one of the rotations you do is OBGYN. And you either love it or hate it.
Right.
And it all kind of starts with the miracle of childbirth. So, you know, childbirth is a really special time in a person's life.
Sure.
And the experience is life-changing and it's intimate. And the bond that's built between a woman and her physician going through childbirth is sacred and it's special.
Absolutely.
And being a part of that is a pretty amazing experience. And I tell patients all the time that we just appreciate being invited into their lives to share in that special occasion, and that feeling is exhilarating, and that's what makes you, you know, become an OBGYN.
That's great.
The love of that. Later on, you know, as you continue to specialize in women's health care, you know, then you start becoming an advocate for women's health.
Sure, absolutely.
And so those are the motivations for you know, becoming a physician and becoming an OBGYN.
Very compelling, and thank you for sharing that with us. And that explains why you're so great at what you do and why all of your clients and patients, they love you.
Yeah, you got to love what you're doing every single day.
Absolutely.
And if you don't, then you got to find something else to do. And so, I mean, you know, I've been doing this for about 20 years, and you know, I love coming over to this office and getting to meet and getting to know so many different people.
Well, we greatly appreciate all that you do in the community and taking care of girls and women and, of course, the babies as they're born as well.
Absolutely. Absolutely.
It is a miracle, as you mentioned. It is really a miracle. So you're one of the primary providers at Triangle Physicians for Women here in Cary, North Carolina, and you provide so many services to women. Share with us some of the variety of services that you provide.
So our goal when we started this practice was to be able to provide comprehensive health care for women between adolescence and menopause. And so as a result, you know, we do a lot of different things. And it focuses on different age ranges. I mean, we do anything from general, you know, gynecologic exams, birth control. As you get older, you start having children, so we specialize in obstetrics. We have a very comprehensive midwifery practice, which is staffed by some pretty amazing people. Our midwives are really fantastic people, and they're excellent at what they do. I think we're still the only practice that does midwifery 24/7.
Oh wow!
We have someone on call every single day to take care of patients that want midwife deliveries. We also have 4 excellent board-certified OBGYNs who are available for emergencies for the midwives, but also are available to take care of patients who prefer having a physician for their delivery.
Okay.
So that's really a great thing. We're able to offer a wide range of patients the experience that they're looking for during their childbirth.
That's great, and it sounds like it's such a team effort that the staff works together to ensure that the mom has a great experience.
Yeah, we really want to be a family here. I mean, and we treat each other, we treat our staff like families, and we like it that we get to invite our patients to be a part of our family.
Sure, absolutely.
And so that's really unique, I think, about our practice. That's, I think, different than the way other physicians might view their practice. They may view it a little more as a job. We kind of view it as family.
Absolutely, and that means so much. I can imagine, number one, on the gynecology side, you know, it's not the most comfortable experience that you have. So to know that someone's there supporting you and providing that service as well, that means a lot. And then on the obstetric side, you want to know that someone's there in your corner. A family member is there in your corner, cheering you along, providing you that motivation that you need and that encouragement.
So in addition to our comprehensive obstetrical service, we offer a lot of gynecologic services as well. We take care of women for contraception. We take care of women for problems. We take care of women for their routine well visits, you know, where they might need their gynecologic exams. They may need a mammogram, and we offer mammography services here in our office, which has been a great addition. People really like the convenience of being able to knock out their annual exam and their mammogram on the same day.
Absolutely.
We provide other types of services, for example, for women who may have mild incontinence. There's a product out there called Genevieve that we recently purchased, and it's radio frequency, and it works really well for building the collagen back, you know, in the area of the bladder that gets disrupted during childbirth, which causes you to leak. We offer menopausal services for patients that include both hormonal and non-hormonal therapies. One big non-hormonal therapy that we use is Mona Lisa. And it's a CO2 laser that helps to restore the vaginal lining back to its premenopausal state.
Interesting.
So there's a lot of different services that we offer here in our practice, and you know, we're constantly every day looking to find ways to be more comprehensive.
Absolutely. That's great. That's a lot of services that you provide, and that's nice because it's almost a one-stop visit for comprehensive women's health.
That's right. That's absolutely the goal, is to try and do everything we can under this roof, make it convenient. We know that our clients and patients are busy people, and you know, trying to get to a doctor is not easy. You know, sometimes you got to get childcare, and sometimes you got to take time off of work. And so we want to optimize your time while you're here in the office to make sure that we get everything done that we can do in a single visit.
Yes, and that's greatly appreciated. So let's talk about the adolescent years. At what age do you recommend the first gynecology visit?
So if you're not having any problems, the first time you need a routine visit is age 21. So that's when we first might see a person who is in their adolescent years. But for problems, we certainly see people, you know, as teens. Most common reason we might see them is for irregular periods of birth control.
Okay. Do I understand there are 4 major stages of a woman's life: the adolescent years, the reproductive years, the midlife years, and also the prime years? Is that correct?
Yeah, I mean, I think you can separate it into that. Yep.
Okay.
Absolutely.
And so let's talk about the gynecology exams that you perform.
Sure.
So in the, I guess from the 20s, that time period, 20s and 30s and perhaps 40s, what annual checkups do you provide in terms of the different type of exams for preventative reasons as well as for care?
Yeah, I mean, so it's important that regardless of what the PAP guidelines are, that you still have an annual exam, okay? And check in with your physician once a year for preventative stuff, you know, whether it's your PAP smear, whether it's for contraceptive surveillance, whether it's for things like general blood chemistries, you know, cholesterol screening, high blood pressure screening. You know, these are all things that are really important, and we really, for years, thought that it really wasn't that important to look at those things in younger people. But now I think we're even seeing that pediatricians are looking at cholesterol screening, because a lot of what we encounter during our lifetime is genetic.
Yes.
And we're learning more about the genetic propensities and predispositions for certain conditions.
Right.
One of the big things in women's health that maybe a little bit later along the line is understanding genetic predispositions to breast cancer and uterine cancer and ovarian cancer and colon cancer. And so going to a person that understands and is able to offer you testing related to that is really important.
Right.
And as you know, life is not stagnant. Life is constantly changing, and so what may not be an issue one year becomes an issue the next.
Sure.
You know, we can't time when somebody in your family is going to get ill, but that can change your genetic history tremendously. If suddenly mom's diagnosed with breast cancer and mom is 48 years old, I mean, that changes your risk for breast cancer greatly, and it changes the recommendations for screening. And so if you're not seeing your physician but once every 4 or 5 years, you can sometimes miss out on a lot.
Right, absolutely. And I like that you also provide screens for cholesterol and taking the blood pressure and making sure that the general overall body is healthy, because sometimes, as we talked about before, is people are busy. Life gets busy, and sometimes they might be seeing you as the only physician.
They sometimes do, absolutely. And you know, we do limited primary care work, but we can do a lot of screening.
Right.
I mean, you know, if you have high blood pressure, I may not be the guy to treat you, but at least I can figure it out and get you to the right place.
Absolutely. And so from the adolescent, young adult years into more of the reproductive years, so when a woman is getting ready to think about having children, are there additional tests or exams that you may perform in your
Absolutely.
annual exam?
Yeah, I mean, you know, you may consider different types of genetic testing again, based on your ancestry. I mean, maybe sickle cell testing if you're African American, or cystic fibrosis testing if you're predominantly from a Caucasian background, or various tests for the Jewish population.
Sure.
And so those are things that you might talk to your physician about. In addition, I think it's important that your physician understand what other comorbid conditions you may have.
Absolutely.
Whether it's obesity, which is certainly a bigger problem today than it ever has been. Possibly, high blood pressure again, diabetes. These are all conditions that can affect how we deal with your pregnancy, and certainly are things that need to be optimized before getting pregnant.
Yes.
And so seeing us before pregnancy is never a bad idea.
Sure.
To at least talk about some of these things that might come into play in that person's individual history.
Absolutely. And from what I understand, infertility is common, and it could erupt from the male and it could be from the female. What are some problems or predispositions that we could see in women that can cause fertility, and what are some preventative factors that we can be proactive and actually prevent, such as maybe obesity and
Sure.
some other factors?
Yeah, absolutely. There's different things that can affect a person's fertility. And although we feel like infertility is common, it affects about unexplained infertility, meaning you've been tested and there's no definable cause, is only about 3% of the population. Okay. But there are other forms of infertility that we can diagnose and treat and get people pregnant. There's obesity plays a role. It can result in chronic anovulation and something called polycystic ovaries. And that can cause something called insulin resistance, and that kind of is a circle, and so trying to break that circle is important. Smoking can affect your fertility. Hypertension, diabetes, if you have a history of pelvic infections, uterine fibroids, which is a benign smooth muscle tumor of the uterus. Endometriosis is a big culprit in infertility. So if somebody's trying to get pregnant and they're young, okay, they're not in their late 30s having their first child or early 40s having their first child.
Sure.
We usually say that if you've been trying for about 6 months and you haven't gotten pregnant yet, that's probably a time for you to come on in and at least touch base with us. We may talk with you and decide that there's some basic tests that need to be done.
Sure.
We may say, you know what, everything really looks good and we really feel like you're going to get pregnant, and we may ask you to try for another 3 to 6 months. But that's kind of the first point where a lot of people will go, you know what, and plus it can also be frustrating, right? I mean, you're trying to get pregnant, and most women, once they decide they want to have a baby, they want to have that baby yesterday. And so it can get a little bit frustrating, and it can be a little demoralizing if you're going 6 months, a year, and you're trying to get pregnant and you're not getting pregnant.
Right.
Aside from the fact that a lot of people are having you have friends that are having kids about the same age.
Sure.
And so they get pregnant fast, and it can hit your psyche pretty bad. And so so getting in at the right time is really important, and that timing is different for every single person, so it's hard for me to give a single recipe for every single person, but that timing varies, and it's just kind of when you feel like, I've been working at this and it's just not happening.
Sure.
That's when you want to come on in and just sit down and talk with us.
Right. Stress is a factor as well, correct?
It
could be short-term.
It can be a pretty big factor, and it's funny. There's different types of stress. There's a stress
Sure.
from work. There's a stress that comes in when you have trouble getting pregnant.
Yes.
And that's a really big stressor.
Absolutely.
And it's hard to shut that off. A lot of times I'll see people and I'll be like, you know what, you got to find a way to not worry about it.
Right.
Just kind of do what you got to do and make it fun and don't worry about it. And that's hard for people to do.
It is.
And oftentimes, people who have really bad infertility problems, the moment they say, we're done with this, and they look at alternatives, they may look at adoption, or they may look at in vitro fertilization, guess what? They turn out pregnant.
Yes.
They get their child home, and all of a sudden they're pregnant. Right. After adoption. And so taking the stress off is a huge thing that you can do for yourself to help you get pregnant. And not think about it, and just kind of do it the way nature intended it to be done.
Right. Conversely, women who are pregnant, there are lots of misconceptions out there. I don't know if some of them stem from years ago. Some of them may stem from cultural reasons.
Absolutely.
But some women have the understanding that they shouldn't exercise, or they shouldn't be careful on the food that they intake, or they shouldn't be careful as far as how much weight they may gain.
Right.
So if you could please share with us just some general guidelines, because I understand every situation is different, every woman is different, but in terms of exercise, nutrition, and an average weight that you should target throughout the 9 months of gaining, that can encourage a smoother labor and delivery experience.
It absolutely can.
As well as a healthy mama and a healthy expecting child.
That's right. So it's interesting because for generations, pregnancy was treated like a disability,
Right.
right? I mean, you know, you got pregnant and it was kind of nice. I mean, you sat around, everybody waited on you, they
Yes.
fed you, and you know, people had healthy kids, but I think we figured out that that's not our life today.
Right.
I mean, you know, women, while they're pregnant, don't sit around anymore.
Yes.
I mean, they work and they have other responsibilities and they're busy in their lives, and so you know, so certainly stress management is one thing. You know, trying to fit everything in your day can be rough, and then pregnancy on top of it is another piece of the puzzle,
Yes.
and that can be a little overwhelming. So managing stress is huge.
Yeah.
I think that exercise is pretty important, right? I mean, would you ever run a marathon without training?
No.
Yeah, and
Although I did.
yeah, and you know,
I wouldn't recommend
yeah,
it though.
that's right.
Definitely not.
you have to think about labor as running a marathon because
Absolutely.
it is a long process sometimes, and it's extremely taxing on your body.
Sure.
And so, you know, the better cardiovascular conditioning you have, and you know, the better shape you're in, the better you're going to do.
Absolutely.
And so, you know, so I think that exercise is important. It's like training for labor. Okay, so I think that's really important. As far as the old misconception is when you were pregnant, you were eating for two.
Right.
Right. So you doubled your calories and you fed your baby. That's not the case anymore. We don't believe that it's important that you eat for two.
Right.
Usually we recommend an increase of 200 to 500 calories a day.
Okay.
Yeah, so that's not a lot.
No, it's not.
You know, average weight gain for a person of normal weight is about 25 to 35 pounds for a pregnancy. If you're a little overweight when you start, it can be as little as 15 to 25 pounds. And you know, it's interesting because you know a lot of women feel like, you know what, I got to go out and I got to lose all this weight, and then I'm going to get pregnant. But you know what tends to happen is they lose all that weight, and then they get pregnant and they gain the 25 to 35 pounds of pregnancy
wow, okay.
plus what they lost. And so a
Yes.
lot of times I tell people, you know what, don't go lose all that weight,
Right.
because what you can do instead is you can just gain less weight while you're pregnant. And I've had a lot of patients that gain 10, 20 pounds when they're
Okay.
overweight. They leave the hospital lighter than their pre-pregnancy weight.
Interesting.
And then, you know, they're nursing and that helps them lose weight.
Sure.
And so they might come in 15 or 20 pounds lighter than their pre-pregnancy weight. And they use that as springboard toward long-term weight loss.
Nation.
If you're a little underweight, then, you know, you might gain a little extra weight. You have a
Sure.
little bit extra to go. But, you know, you want to, you know, take care of the diet and exercise, and you want to make sure that you're doing the right thing. But you also have to remember that pregnancy is one of the few times in your life where you can gain weight and people are actually happy for you.
Right.
And so you got to enjoy a little bit of that. You know, don't deprive yourself the entire pregnancy.
Sure.
You got some cravings, feed them.
Indulge a little bit.
Yeah,
Yes.
absolutely.
Yes.
And so, you know, it's important that, you know, everything in moderation,
Right.
right? So we want to make sure that we're healthy
Yes.
and we do the right thing, but at the same time, we want to enjoy it a little bit.
Right. And congratulations. I understand that you have won some honors and awards of being the best OBGYN physician. So congratulations
Thank you.
on that.
Yeah. I mean, you know, they've done some surveys here and there, and
Yes.
you know, and they're a lot patient-driven, and I'm always flattered that people are so kind, and you know, that we have this special relationship with our patients. I always tell everybody, you know what, it's a mutual admiration society.
And I just want to touch a little bit on women that are experiencing menopause. There's always
Sure.
this buzz, whether in the office, at home with family members, or even at the gym, about some of the uncomfortable experiences that they may have.
Sure.
And so share with us some of the signs and symptoms that are common to
Absolutely,
menopause.
yeah. So it's interesting because people in their 40s, you know, they get menstrual migraines and they get breast tenderness and they get, irregular bleeding and they get heavier bleeding. And one of the things that they come in and they go, you know what, I'm really looking forward to menopause.
Huh.
And I always say, well, you know what, the grass is not always greener on the other side. Menopause is rough. I mean, you know, there are changes that occur. I mean, you know, and it can start with something as simple as hot flashes,
Sure.
night sweats, and vaginal dryness.
Okay.
You know, and those are things that can be pretty mild, or they can be completely debilitating.
Sure.
You know, other symptoms of menopause can include sexual dysfunction, pain with intercourse, changes in the way your orgasms feel. You know, you can have issues related to your cognition, you know, weight gain, particularly in the midsection,
Right.
which drives women crazy. You know, you might experience changes in your skin and changes to the texture of your hair. And so, you know, menopause can be difficult.
Sure.
Now, not everybody experiences these symptoms.
Right.
You know, so treatment oftentimes needs to be tailored for what you're feeling.
Now, is it true that some women don't even experience menopause?
Absolutely, yes. Some people don't, and
Okay.
you know, so you know, people who tend to be thinner don't get as many menopausal symptoms.
Interesting.
People who are in better shape, exercise, they tend to get fewer menopausal symptoms. People who eat a really lean, healthy diet, they tend to get fewer menopausal symptoms.
Okay.
And so, you know, women lower stress. You know, so you know, it's funny because when we look at medical conditions, it seems like there's always a few themes, and it's always diet, exercise, weight, you know, maintaining low stress, you know, and it helps in all aspects of your health.
Sounds like you provide a lot of comprehensive services, counseling, and information for women of all ages.
We absolutely do.
And
You know, it's fun for us to do that.
with that said, if you are in need of any of Dr. Seshadri's services and you want to go to the website, Triangle Physicians for Women, or you can pick up the phone and call them. They provide a comprehensive service package for all women. So whatever stage you are in life, seek their counsel. As you mentioned, there are various providers they're here. It's a one-stop shop. You can receive all of the information, the resources, and the care at Triangle Physicians for Women. So Dr. Seshadri, you've been amazing.
I appreciate
I really
taking
appreciate
time out
your
of your day to come talk with us.
Thank
I hope this
you.
is helpful to some people.
Absolutely. We really appreciate your expertise, your knowledge that you've shared, and we appreciate, most importantly, all of the touches that you provided to the people in the community, helping them with various problems that they may have had, or even on the preventative side, making sure that they don't have any problems.
That's right.
So we greatly appreciate all that you do for the community
Yep.
within the Triangle area, and we wish you the best in all that you do and all the
appreciate it.
services that you provide.
Absolutely, and we look forward to you know, continuing to do this for years to come. We're moving out toward Holly Springs, and so in April we'll have that coming for those of you guys that don't feel like driving to Cary all the time.
Sure.
So we're excited.
Congratulations, it's expansion. This is
Yes.
a year of expansion.
That's right.
So congratulations
That's right.
with that.
Yep.
And again, we thank you for joining the Wellness Show. As always, we want you to be well.